Hi guys, hope you're well. This is a really quick video on my O&G rotation, obstetric and gynecology rotation as a GP trainee. 8 things that I took away from my 4 months. Since I did my pediatrics rotation video, a lot of people have said, can you do a similar one for obstetrics and gynecology? So here it is, 8 things I took away. I did my rotation in Sattenwell Hospital in the West Midlands. I had brilliant consultants. I learned so much and I felt so much more confident about O&G afterwards. Now this video hopefully will allow you to be prepared and get the most out of your own O&G rotation if you do it as a GP trainee. Let's go. Number 1, the first thing I took away from my 4 months in O&G, and this is something that I think is synonymous with a lot of different people who do O&G for the first time, is that I walked away much less daunted by dealing with pregnant ladies, we're dealing with gynecological conditions, things that I'd never really dealt with before. I dealt with elderly care wards, I dealt with acute medical wards, but O&G was a whole different ball game. And apart from doing a little bit of medical school, it was a brand new concept. I felt daunted. I felt like I didn't really belong there for the first few days. But by the end, I felt so much more confident in dealing with these types of scenarios in primary care when I was doing GP rotations. And it helped me a huge amount when I came out and I was working as a GP myself. So you're going to feel much less daunted. So if you've got an O&G rotation, embrace it. You're going to feel so much more confident at the end, and much more than I tell you now than when you walk in on that first day and feel a little bit overwhelmed. Now, the second thing I took away was an immense respect, immense understanding, and just a real liking for midwives by the end. Now, when I first went in, I didn't know what to expect, but these guys, after a few days, I realized these guys run this show. Like, they know what to do. They're so skilled. The whole place runs on autopilot. They are the people to turn to if you have any queries initially in O&G. And I developed a huge respect for them. I really, really liked them by the end. And we got on really, really well at the end of my 4-month rotation. And it's something that I'd really encourage you to do. If you're doing an O&G rotation, get to know your midwives. Ask as many questions as you like. Yes, they're busy sometimes and it might be difficult to give you an answer there and then and teach you all the time. But, they really want to teach. And they are a huge, huge source of knowledge, experience, and I learned that to my credit. And when I went out into the community, I knew so much more about a midwife's role, and I found it so much more useful to be able to engage with them when I was outside of a hospital setting, when I was dealing with patients in general practice, because of the experience that I had when I worked inside hospital with all the different midwives that I did in my rotation. So really get to know your midwives and ask them lots of questions, and you'll find that your rotation is so much more productive and valuable. Number 3, the third thing that I took away, and this might sound a little bit funny, but I got used to examining pregnant abdomens. Now, it's a whole new ball game examining pregnant abdomens. Yes, you examined lots of normal abdomens before. They are normal, but non-pregnant abdomens. But when you have to go and start doing examinations with a baby inside, like just that skill of understanding, what's normal, how to look out for something that's not quite right, how to listen to fetal heartbeats, how to do things like measurements, like these things were so alien to me when I first started. Again, I'd done medical school rotations and I'd done a few examinations then, but it was such an alien concept. But by the end of my 4 months, I was confident enough to be able to do this outside again. When I went into my GP setting and did examinations there, because of the experience I'd had in my 4 months, I didn't really realize I was learning a lot when I was doing it in-house in hospital, but it was only afterwards when I was examining patients outside of hospital settings that I realized I'd got so much more confident in examining pregnant abdomens. So that's one thing that you've got to do, obviously in your rotation as part of your job and role, but really embrace it and try and work out what's normal so that you can find and work out what's not when you see it out in the community. The fourth thing that I became really comfortable with after doing my 4 months of O&G as a GP trainee was working around antenatal screening and getting used to those kind of conversations that I then had to have later on outside in the community. How did I do this? I went to antenatal clinics and I got used to talking about pros and cons and answering common questions that we get about screening. Is it right? Is it wrong? When should I do it? What are the right times? What happens? What's this scan versus this scan? And why this blood test now and why repeat it later? These kind of questions were so valuable for me to be thrown at in my O&G rotation. So I had to go out and find the answers so that when I came out 4 months later, I had a really good understanding of what the antenatal screening process is, pros and cons, some of the common questions, and therefore some of the common answers. And that really helped me later on again in my GP rotations and whilst working as a GP. Antenatal screenings, really get used to them. The fifth thing I took away in my 4-month rotation was the importance of making sure that you rule out pregnancy, even in the situation where you think or a patient thinks that they can't be pregnant. And this happened because I suppose I saw so many people coming in who didn't think they were pregnant, but were found out to be pregnant. And therefore, going forward, when I worked out in the community, this was something that really stuck with me. And I think only going through that experience gave me that feeling that, no, I've got to be sure, I've got to double check, because you don't want to miss things, of course, like ectopic pregnancies and, and other things that can be missed if it doesn't cross your mind. So one thing that I picked up was that almost gut feeling to make sure I rule out pregnancy, even in situations where I don't think someone might be pregnant, and even sometimes the patient doesn't think they're pregnant. It really stood me in good stead, and I picked up quite a few in the community where people had no idea that they're actually pregnant themselves. Number 6, I finally understood HRT by the end of my ONG rotation, hormonal replacement therapy. How did I do this? I went to, I don't know how many clinics, probably 4, 5, 6 HRT clinics. I just went in, I sat in, I asked if I could, just to understand this concept, because HRT was something that filled me with dread before I went into ONG, but by the time I came out, I understood it. And of course, when I prepared for AKT, when I prepared for CSA exams, that knowledge really helped me, because a lot of my colleagues were struggling with HRT and I had some basic concepts. Yes, once I hadn't talked about it once I went to my next rotation, I forgot about it. But then when I went back to revise it again for my exams, it was so much easier because I understood core concepts through listening to what registrars and consultants were talking about to patients in clinics, so that when I came around to try and learn it myself for exams, it was so much easier. So if you're doing an ONG rotation, do not leave your ONG rotation until you understand HRT, and add contraception onto that as well. Best way to do it, go to clinics, sit in on them, ask if you can see patients first, and you really will understand these concepts, so that when you need to do it for your exam later on, and of course you will need to, it's so much easier. The 7th thing that I got out of my ONG rotation is that I learned so much during my theatre time. Now, I didn't really enjoy going to theatre until my ONG rotation. In medical school, I didn't really enjoy doing it. In other rotations that I had to go to theatre, I didn't really enjoy doing it. But in this rotation, I used it to my advantage so much. I asked so many questions when I was in theatre. I learned so much from the registrars, the consultants who were leading it. And I think it's because I was lucky, because there were people who were happy to have questions asked, not even about procedures going on there and then, but general things. What would I do if I saw this person in the community? How would I deal with this? How do I assess this? I really made use of my time. Now, sometimes, as a GP trainee, remember in ONG, you're going to be doing lots of theatre, assisting on cesarean sections, gynecological procedures. It's going to be part of your role, but embrace it. Use the time. Find that information. Sometimes there's a lot of time in a procedure, and using that to advantage, rather than kind of sitting there and thinking how many hours left, use it. And that's what I did. And because I did that, I actually started to enjoy my time, and I found it so much more valuable than if I just sat there and just waited for procedures to end themselves. The 8th thing that I took away from my ONG rotation that really helped me when it came to AKT and CSA was I understood gynecological cancers inside out. Like, for example, screening programs, how they work, what is colposcopy, how to counsel someone on what's happening, how to look at what the different results mean for cervical screening. Not just that, going through suspected cancer for ovarian cancer, or the guidelines for suspected endometrial cancer. I really got to grips with the urgent referral criteria and everything around gynecological cancer, or cancer in women's health in general. Now, of course, these are going to come up in your medical exams, and knowing them in advance helps when you go to try and learn them when you're prepping for exams. But I really embraced it. And again, how do I do that? I attended clinics. I attended urgent 2-week referral type clinics within gynecology of different types. And I really therefore understood lots of everything, not just the medicine and the guidelines and the referral criteria and the investigations. Of course, all that helped, but also I learned so many more softer skills from seeing consultants and registrars talk to patients who'd come into those clinics. Obviously dealing with things like anxieties, worries and fears, finding out more than just the medicine is really important to try and deal with things like when you break bad news. Those kind of things were invaluable for me. And in ONG, I think I picked up so many more soft skills than in lots of other rotations that I did, because I jumped into those urgent cancer or suspected cancer clinics. And it's something that I'd really recommend you do. not just for learning the medicine, but for all the other bits that will help you when you go out as a GP trainee and work as a GP in the future. So there we go, 8 things that I took out of my own O&G rotation as a GP trainee. Now, if you're going to do O&G in the near future, or you've just started, or it's on your rotation list, a couple of things I think are really important to do. Number 1, look at the PDP that we've written for O&G before you start your rotation, or as soon into it as you can. Go to the website, auroramedicaleducation.co.uk, go to the blog section and click on the PDPs for GP trainee blog. We've not just got O&G, we've got around 20 other rotations on there as well, but it starts to give you an idea about what are the kind of things that I can try and achieve in my 4 or 6 months, rather than just kind of going in and just passing the time, and then you end up not really learning anything. Number 1. Number 2, think about what are the things that I need to understand for my exams going forward, and make sure you try and work on those things as well. Look, when it comes to AKT and CSA training, we do lots of this. People often ask me, can you help me with O&G stuff, whether it be guidance for referral for cancer, whether it be HRT, whether it be contraception. If you can get some of these things ticked off in your rotation and understand concepts, when it comes down to learning them for exams, you're in a much better position. Now, we do so much for GP training, AKT and CSA, day courses, online courses, audio courses. We've got so many ways to teach you in the way that suit you best. So have a look at the website, auroramedicaleducation.co.uk, and have a look to see what would suit you best. If you're looking on this on YouTube, subscribe. Facebook, follow. Instagram, follow. Twitter, follow. We do so much free teaching, because I remember my time as a GP trainee and I didn't have time to go and read books and guidelines every day. So we've tried to condense it through social media and through our online and audio material. I really hope this video has been of some value. If you know anybody doing O&G, please do share this video wherever you're watching it. I hope it can be of value to them as well. I hope to meet you in the future. Hashtag CanPass will pass. Hashtag I went with Aurora. Have a good day.